Welcome to Benita's maternity program antenatal class. Today we're speaking with Sister Talia on amniotic fluid complications. Welcome, Sister.
Hi, everyone. Thank you. Yes, amniotic fluid complications. So as you can see, that baby in the picture is laying so nicely surrounded by all these fluid, and that's what we're going to be discussing today. So what is it? The fetus in your uterus is surrounded by amniotic fluid. It resembles water, and it actually throughout your pregnancy starts to develop because baby's in a little sac, amniotic sac, and the fluid is in that sac. About 12 days after you get pregnant, the fluid starts to form, and it can actually spill from your vagina, which we call it water breaks, and that's a symptom of labor. And this is later in pregnancy, and that's usually the fluid that comes out when we have the term your water breaks. There's more to the amniotic fluid than just fluid in which the fetus floats. It helps the fetus to stay healthy and protected. Amniotic fluid also contains nutrients, hormones, antibodies, and other fluids. So the fetus eats the amniotic fluid. This is like basically almost like food to them, and subsequently excretes it through urination. It circulates continuously. The fetus or the pregnant individual may experience some issues if there's insufficient or excessive amniotic fluid. And that's what we're going to discuss today. I know with many gynae visits, you lay down and doctor tells you the fluid is a bit low, fluid is too much, or fluid is fine. And then we get quite stressed out as moms because we think, what does that mean? And they would never go into much depth or just a little bit of detail. So today I thought, let us take the time to discuss this topic because it's very relevant, and it happens a lot of times in your antenatal visit that doctor mentions this. What is the function and role? The uterus, it usually has amniotic fluid for a number of reasons. We've mentioned earlier for the growth and development of our baba, but among other things, I've listed what it actually does. It prevents infection to the unborn baby or the fetus. It helps the fetus to move, and it cushions it as well. Remember, if we should fall down, the amniotic fluid is kind of a barrier against the direct abdomen that you would have. So if it's directly against that cervix abdomen, it would be too much. So the fluid keeps baby moving, and it cushions baby against any blows. It aids with the growth of your baba. Like we mentioned earlier, baby eats it. So the bones and muscles and everything grows. And it holds compression of the umbilical cord. Because as we are feeding with the amniotic fluid, the umbilical cord is creating lifeblood between you and baby, and life nutrients, blood. And that resource, it's not to be taken lightly because too little fluid can oftentimes cause compression. So that's something it actually aids. That also aids in the development of the respiratory and digestive system. But a bit later, we'll go more into depth about what it does to the respiratory system. It helps control the baby's temperature. So it's like a temperature controller. And it shields it from your motion, like a fall or sudden blow. So this is very important. This is just the start of what it can do and what actually the side effects of too little or too much is. But we must remember that's what babies are so drawn to bathing. If you look at a newborn baby, they love bathing. It suits them. They may get a bit upset about the temperature, taking them out or undressing them before a bath. But once they're in that bath, they enjoy it, because that is their norm. They know water. So this is also a cue to new moms. Take your baba. If baby is really, really having a hard time, a newborn, take your baba in the bath with you and just put them on your tummy or here. And that will really, the water, and just tap the water gently over them. It really suits a crying baby because they come from water. It's the first thing they know. And now they're into this natural air. They're into this kind of harsh aerobic world. So long story short, a successful pregnancy requires amniotic fluid, which helps the developing fetus to get ready for this outside harsh world. How do I know if I have fluid and how much do I have? So basically, doctor does every antenatal visit, or your midwife, they will do ultrasound. That's basically the easiest way for us to determine. Oftentimes, when there is some things they detect, like too little or too much, they will ask for a detailed type of ultrasound. And usually that is done with pre-authorization from your funding. Your doctor will advise you on that. What are the cost entails, what happens, and it won't be done by your gynecological room or your midwife. There's specialists that does special scans. And that is a reason why they're so pedantic in checking that. And if they do request you to go, because they need to see the amniotic fluid pockets and to check the particular regions. And sometimes our general scan ultrasounds does not show us everything. And oftentimes they may ask you. So if they do ask you, just know why they need to kind of specify what is going on with the amniotic fluid. So what shade is the fluid in the womb? I also just want to mention to moms, this is not made for you to stress, do you have too much or too little? Your gynae will kind of take you week by week as you go for your visits. This is something he will check and he will mention it to you. If he mentions it to you, he will start telling you, this is what I want you to do, A to B. So with the visit, don't stress while you're pregnant and think, do I have too much, too little? You will really check it on every single visit. So the shades of the amniotic fluid, we say straw color. So it's almost like hay color. When we get to a color like brownish, so now you're 9 months pregnant, water broke, it's everywhere, and it's this light yellowish color, or it started to dribble a little, and you thought, is it, am I water breaking, or am I wetting myself? You've changed your panty and your pants, you've put in a maternity pad. That maternity pad you go with still in place to the maternity unit, and your midwife and gynae will check it. What we check is color. We check the consistency of that and also the weight. The color will indicate to us the health of the baby. So straw color is quite normal, mixed with a little bit of blood maybe because your mucus plug came out. That's still fine. But if we see a brownish color, that indicates that your baby has passed its first stool, which is meconium. It's a very dark stool, very sticky stool, but it tells us that baby may be in distress. Okay. So it's very important that we then know to follow all the things. So what a lot of moms does, they water breaks, they go for a shower at home, they come in later. So now we kind of don't know what's happening. They've changed their panties all the time or thrown away the pad. We need that pad. We need to see what's really happening with baby. So if the fetus breathes in that amniotic fluid that contains that meconium, especially with the normal delivery, a fetus may get some meconium aspiration. You can think meconium is stool, so it can never be good to be inhaled, and then it may need some further medical care. Oftentimes, it can happen where it's a very rush birth, baby came out very suddenly, even the doctors didn't have time to check a pad, and baby comes out, and we've had very, very good immediate action, and babies are very well, but we don't want to put any mommy or baby through that stress if we can prevent it. So even if you're at home, your water breaks and you see that brown color, that must tell you to get to the hospital as soon as possible so that we can start measures in order to start baby to come. And the team may be ready then to aspirate. That means we take a suction and we immediately aspirate as your baby coming, take out whatever meconium may have been swallowed. So what scent does it have? It ought to have no scent at all. What I've noticed as a midwife in all the labor rooms, it usually has a very fresh, like rainwater that fell on a sunny day, and then it has like a ground smell. It's a very fresh, earthy smell. And that's something that kind of in my mind, it may, remember, each one's nose has a different indicator for sense. It's very unique on noses. But that's something that I always know. This mom may have had some water break. Immediately, if I see it, I smell that, it's a very earthy smell. I know it may have possibly happened. But it's something your doctor will check straight away. Again, the word meconium will come up. It's something we check. Meconium stain will always be checked. So what is the typical amount? I'm the same. I had to put this in because I want to know, like, if you say I have too little or too much, what is it? So depends, first of all, how far along you are. How close are you to approach your due date? And because as you are approaching your due date, remember, baby is taking up more space, is growing. So water will get less. It's like us in the bathwater. The bigger we are, we get in the bathwater, it looks so much, but if we get out, it's like nothing almost left. So it goes, water declines, baby grows, and you will see a gradual start of decline. It's usually from 34 to 36 weeks, and it measures to where we know baby's almost going to come out. So it's usually less than 1 liter of fluid that's present in the sac when we reach our maximum time of pregnancy. And that's a normal amount. Some moms maybe have less than that or more than that, and that is when we start looking at our other complications. So, what indicates fluid leakage? I mentioned to you earlier that there may be some leakage even before your due date, and that would be anything before 36 weeks. We then call it leakage because remember, we are not anticipating baby yet. Baby still needs to breathe within the amniotic fluid and within your stomach. Baby cannot physically breathe outside the body as yet without assistance. So, because it's odorless, it's colorless, and many pregnant women have leakages because of this big growing baby sitting, standing up. There may be some leakage, and it could just be wetness of the panty or the pants with normal urine leaking. So, what do we do? How do we compare it? I've mentioned to you a slight smell of earthiness. I've also mentioned to you color. However, that too can sometimes not be determined. It's in the middle of summer, it's so hot, everything feels wet. So, what I tell moms, change your panty and your pants and put in a maternity pad. In the afternoon, so you've put it in maybe 7 a.m. By 12 o'clock, so we've given it a few hours, you check it. You go and you pee, pass urine, and you check your pad. You actually take it out of the little panty and you feel it on your hand. You throw it down like this. You will feel this is quite heavy. Because remember, you won't be leaking urine all the time if you've actually been passing urine. So now something is telling you to you something's off. Now you look at the color. Okay, it's maybe more see-through than urine. It's also looking, smelling to me, it's just a different smell. Then I always tell moms, phone immediately into either your hospital where you're going to give birth or your gynecologist or whatever your gyne or midwife has advised you as emergency numbers. Keep that numbers at bay and keep it nearby because that's the time you're going to be phoning that and having them check that pad. You put the pad back in your panty, you pull your pants up and your panty and pants up, and then you make sure you get to the hospital so that we can check it. It can be sometimes false alarms. It happens to a lot of us. Then we can say, it's fine, mommy, all is well, baby is well, you can go home. But let's be more on the side of careful than not careful. So water breaking, so part of water breaking can be premature water breaking before we are supposed to have a baby and then our actual due time. So some moms will have leakage, even the actual due time, they'll have a slight little leak and not a gush. Others will have a real rush of fluid. It's warm, it's runny, it's late in pregnancy, and other secretions will also be quite evident. Okay, so that will always make it difficult to distinguish, is it your water breaking? Even in the midwifery unit, we have some tools. We have certain papers that we place on the pad to check that it is that fluid. We even sometimes have to investigate further. So don't be scared to call. Pick up that phone, that numbers your gynae gave you of the unit, phone them and just check that everything is okay. Okay. So normally with low amniotic fluid, we call it oligohydramnios. What it means, it's an insufficient amount of fluid. In general, this is the riskier of the two. When we say a lot of amniotic fluid and low amniotic fluid, this is the riskier one. Why? Because we need that fluid, okay? It's usually first 6 months of pregnancy. It can result in miscarriages, early births, some physical things as the growing of Baba, and everything is dependent on that, as well as improper lung development. The following issues could arise because of it. Remember, I mentioned to you firstly that we need the fluid cord to prevent cord compression, while without the fluid or very little fluid, we will have a cord compression. Then fetal growth restrictions. So usually this is going hand in hand with low amniotic fluid. If doctor starts mentioning that, by next week, he will tell you the following week that your baba is growing less and less. Then we have respiratory issues that comes up. So respiratory issues is also very important to look at because it will go hand in hand with less fluid because they breathe in that fluid environment in your abdomen. And then it may add to a greater likelihood of having a C-section. So with the low fluid, we discussed it. And then we also look at what is the treatment that's available. Depending on how far you are in your pregnancy, your doctor may decide to induce you. Okay. So, oftentimes, when we have very low fluid, we may say to the moms, we're rather going to take baby out earlier because we don't want to risk all those risk factors that I mentioned. But the same may happen with a higher level of amniotic fluid that we may decide to change our birthing alternative, maybe from natural to cesarean or even an earlier natural or cesarean birth. So what happens if your fluid is too high? We call it polyhydramnios. It is a medical term of excessive amniotic fluid. It is a rare ailment. So both of them are actually rare. And sometimes some moms will have very swollen feet, shortness of breath, and constipation, which is just a sign of pregnancy also most of the time. But it will go hand in hand with, remember what I said, doctor will do that ultrasound every time you go. So it will go hand in hand as symptoms. So if you have swollen feet, shortness of breath, or constipation, please don't just think it's because of this. The two goes hand in hand together. Doctor will confirm it by doing an ultrasound. So what can happen if I have too much? You always think too much is better than nothing, but there is issues that can arise. So remember, there's a lot of pressure on the organs as well, on your organs. You have too much, we have pressures on your kidneys, we have pressures on your body, and that's why you are so swollen then, specifically. Premature birth or labor, there's too much growth in the fetus, so a very big baby. Postpartum bleeding, and oftentimes we get stillbirths because of this, a lot of fluid and overdue. So a lot of these big babies will go overdue because they love it there. I mean, they got the best of all the worlds. They're floating in this nice pool all the time. So they stay longer, they're bigger, and there's not enough time now anymore for them to be there. They should have actually been starting to come already. So doctors oftentimes may change the date of delivery. So how is this managed? So with the polyhydramnios, it's not usually done medically where we now will do surgery or anything. We normally say bed rest, early induction, a small amniotic fluid extraction, but that's in really the most it's certain scenarios. So this, remember, it's not one treatment fits all. So we will look at risk factors as well. But oftentimes bed rest is a very important thing because the feet is so swollen. There's so much pressure on your organs as well and your body. We will rather keep you off your feet until your due day, which we will induce earlier. So can drinking water increase my amniotic fluid? Because now the contrary is I've got now too little. Must I drink some more water? It is really unknown. Okay. So some people will say, take some more water in, But we do know when you're pregnant, we don't want you to have 5 liters of water a day. It's too much on your organs, okay? So that's what often happens when mom thinks, I've got this, maybe I'm not drinking enough water, I'm not eating. When you hear the first week doctor says your fluid is a bit less, next week your baby is a bit too small, then moms just start overeating and thinking it's something they're doing. But it's nothing we can fix like that. Bed rest is very important as well for moms with too little fluid. That's one of the key things that we can do on our own. And then the rest is medical monitoring, checking the weight weekly, checking fetal heartbeat in that sonar we do weekly and scan, checking the positioning of baby, and also getting to our dates of actual delivery. So I would not recommend drinking liters and liters of water, but your normal 1.5, 2 liters a day, that's fine. But please don't overdo it because it may end up more damaging. So now we have our newborn baby. So basically, a newborn baby is capable of enduring without amniotic fluid, okay? This is what we are thinking. And no, the baby needs the amniotic fluid in the uterus. However, we do know that when a baby is born, he starts breathing without that. So that's the first breath that we call it. And so baby, without the amniotic fluid, baby cannot thrive in the uterus. But a newborn can go without the amniotic fluid. Then one of the questions was, can a newborn, and I took these questions from moms calling and oftentimes asking these questions. And I thought, I always think a question is it's a great thing because it's never just one person thinking that thought. Often others have and don't want to ask. So can a newborn consume the amniotic fluid? So remember what I said, fetus does live off it, okay? So they need it, it helps them grow, it has nutrients in for them. But a newborn, however, can consume it with that first breath. They can inhale it and it can actually go in the nose, in the mouth. And that's why we don't want meconium to pass. If it's just amniotic fluid, it's fine. But as soon as it's stained with meconium, which is poo, then we have a problem. And then does an unborn child inhale amniotic fluid? No. If in the uterus, they can breathe it in, breathe it out, they can swallow it. It will do nothing because they haven't taken their physical first breath of life that they would do when they're outside the womb. And then they can actually inhale it in their nose, and we need to aspirate then and take it out. So that is often something that happens. A fetus growth is aided by amniotic fluid, which also shields it from harm and disease. Amniotic fluid is swallowed by fetuses who then practice breathing it while voiding it. It's very complex, but they do it. That's how amazing these little babas are already in the womb. Some expectant moms have excessive or insufficient amount of amniotic fluid. If this occurs to you, your healthcare professional will monitor you more closely or carry out further ultrasounds. Don't be afraid to speak to it with your practitioner. And if you have any questions about your pregnancy or notice fluid oozing from your vagina, please be certain to let your midwife and doctor know. Pick up the phone if you have any questions to them, because it's very important that they are aware of what's happening, because it does influence the health of your baby as well as yourself.